As we continue to work through the many challenges presented during the COVID-19 crisis, an area of concern that was raised by many healthcare providers was concerns related to the management of the airway for intubated patients, as well as the difference between a wet circuit and a dry circuit and the impact of those on available tubing for turning patients. A visual review of the wet circuit versus dry circuit will be presented on the next slide. However, the differences are highlighted here. A wet circuit sits 7.5 inches lower than a dry circuit, as the heater, which we used also with the 840 vents as well as with the high flow nasal cannula, sits 7.5 inches below the connection normally used on a dry circuit. This lack of additional tubing requires that the nurse managing the airway during a turn pay strict attention to the shorter amount of ventilator tubing available and to the tension being pulled on the airway adjunct, such as an endotracheal tube or tracheostomy. Please contact your respiratory therapist with any additional questions or concerns. Pictured on the left is a Hamilton G5 ventilator set up with a wet circuit. You'll note the heater present on the bottom left. In the center is a dry circuit. This circuit was used during the COVID-19 crisis as well as for other patients who may experience an airborne disease because it does not provide moisture to the circuit itself. The right-sided picture shows the difference in height of tubing based on whether the patient is on a wet circuit as a dry circuit. You'll note that there is a 7.5 inch decrease in the available tubing if the patient is on a wet circuit. In addition to the decreased available tubing due to a wet circuit, please also remove the tubing from the U-shaped gray plastic holders during a turn in order to release the maximum amount of available tubing. Once the patient's been properly positioned, please resecure the tubing in the gray holders. When extubating with a Hamilton G5 ventilator, it is imperative that respiratory therapy be present at the bedside, as the ventilator may increase or decrease the amount of air present in the endotracheal tube balloon during the course of intubation. While only 10 milliliters of air may be used during the actual intubation, while the patient is maintained on a Hamilton G5 ventilator, a variable amount of air may be present in the patient's cuff in order to maintain safe airway pressures. The ventilator may inflate or deflate the cuff in order to maintain those pressures, and when going to extubate, the patient's cuff may have well more than 10 milliliters of air present. With respiratory therapy using the IntelliCuff system, the cuff can be safely deflated in order to prevent vocal cord damage and reduce the chance of vocal cord paralysis. Thank you for your attention.